Typically, men want to know, what can I expect? Is it safe? Is it going to hurt? Their list of concerns typically are different than women. A lot of men have Botox done. Botox for men, we're usually going to be doing the glabella, the frown lines. They've been nicknamed the 11s right here, or the forehead lines going across is the most common with men. We do crow's feet also, the sides when you smile. We do the crow's feet, but with men it's more the frown lines and the forehead. And it's a quick, easy procedure to do. It really is just a few injections. It's very quick, it's very easy. You don't see it right away like you do with filler, with Botox. It takes up to 2 weeks to see the full result. Men do have filler done. Typically for men, it's going to be to fill in these lines here, the nasolabial folds. I would say is most common. Sometimes maybe down here a little bit. Men come in a lot for laser hair removal. Typically it's going to be the back, the shoulders, the chest. And some men come in on their own accord, and some come in, because their wives have, encouraged them to. But really, it's just for them to get a reduction in the hair. It's not all men, but some men just have excessive hair, and they're just not comfortable on the beach or whatever. It's a personal thing. So, a lot of men come in with facial broken blood vessels. Typically in men, it can be the nose, the nostril, the cheeks, or the chin. And they can be mild, moderate, or severe. We have a laser to treat that. It's a laser, it's been around for a long time. It's called a KTP laser. And when Dr. Harkaway does the treatment, it's targeting the blood vessels. So you can get rid of those blood vessels on the face. It usually takes 1 to 2 treatments. There's not really any downtime, but you wouldn't want to do it before a special event, like say that weekend, because what happens is wherever Dr. Harkaway treats the broken vessels, it kind of looks like little cat scratches is kind of how we describe it. So you wouldn't want to do it right before a special event. Other than that, there's really no downtime, and it works well, and we've been doing it for years. Many men come in for consultations for laser lipo. So the goal of laser lipo is to volume reduce a problem area that you have. It could be the abdomen, it could be, the love handles. It's a problem area that doesn't really respond to diet or exercise. Another area that for men that we can treat with laser lipo is the medical name is gynecomastia, and what it is male breasts. And some men come in for a consultation if that's something that they have, fat has accumulated into that area, and they're very self-conscious about it and very unhappy with it. And this procedure works well on that also. The next procedure I'm going to talk about is called Thermatite, and it's very exciting. This procedure is very exciting because not everyone that comes in is a candidate for laser lipo. Some patients have hanging skin, loose skin. There's a lot of laxity. It can be in the neck, the jowl area here, or for that matter, it could also be the stomach. And they don't really have very much fat at all, just a lot of sagging, loose skin. Thermatite, the goal of Thermatite is to tighten the skin, as much as possible. Thermatite is actually radio frequency. So radio frequency, which is heat, is being delivered under the skin. It's temperature controlled, and when that happens, it causes the skin to contract and tighten. With that procedure, we have patients coming in just 2 to 4 weeks after the procedure, and there's already, you can see a significant improvement, and the improvement continues over the course of the next 6 months. Any gentleman at any age interested in finding out more information, give us a call, schedule a cosmetic consultation. We do them at no charge. They're complimentary, they're one-on-one, they're very informal. First, I talk to the patient and we go over the concerns, and then I bring Dr. Harkaway in. And we want to address all of your questions, all of your concerns. We want to see what your expectations are, because that's very important too. And we encourage patients to go home and think about it. Anything that you're going to do, you need to be comfortable. You have to decide what's best for you. But if you come in, it's nice because you can make an informed decision. You can find out all the information that you need to know, go home, and then, you give us a call when you're ready.